everyone. Welcome to this first year of PBL. My name's Ayala. Since it's the first day of PBL and we're all going to have to work together for a few months, why don't we spend some time getting to know one another?
It's been almost a year. I don't really want to know them any better.
Let's start with an icebreaker. How about we go around, say our names, and a superpower we would want?
Alright, I guess I can start. My name's Ben, and I would love the superpower to speed up time.
Wow, so cool. Why that particular superpower?
So I can make this PBL end. Just kidding. I was not kidding. I do not like PBL.
I feel like what we all want is the superpower to heal people. And as a team, we can. Just like with teamwork, we're going to solve this PBL, right?
What a great attitude, Ritika.
Thank you.
Oh my god, I'm never gonna make it through this PBL.
But guys, before we start, we must make a snack schedule. Everyone knows the most important part of PBL is the snack. It's very, very important. If the PBL doesn't have a good snack, the PBL can't be successful.
Yeah, that's a great idea. Let's go around and say if we have any dietary restrictions.
Are you serious right now, Ritika?
I'm gluten-free.
I'm on a high-protein diet.
I've actually been on a juice fast.
No! No! Oh my god! What on earth are we gonna eat?
It's fine, I'll just bring snack tomorrow.
Good luck with that.
All right, let's get down to work. Who wants to read part 1? Somebody?
I'm definitely not reading.
I always read. I'm not doing it this time. I'm not actually sure why it's silent, but I'm iMessaging, so it doesn't really matter. I hope they don't ask me a question or something like that. I guess I'll read, maybe.
I know that Lolita loves to read. I mean, she does it every time. That's why I don't volunteer.
So we've got a 56-year-old male, I am sick, presenting with some chest pain and... What?
Sorry, I was just thinking of something funny. Go ahead.
See, there was this really cute cat video.
That was great reading, Lolita. Now we need a scribe.
That's a fabulous idea, Ritika. You're a real PBL pro.
I am a PBL pro. I dedicate my life to PBL. I'm going to get such a good eval.
I can do it. I've been with Judy on PBL before. She has the worst handwriting.
So let's go around and list some facts. He's a 45-year-old male.
He has fever, joint pain, headache, rhinorrhea, cough, chest pain.
Sexual dysfunction, rectal bleeding, abdominal pain.
Got his tonsils taken out when he was 7.
He has 3 dogs, and the second one is named Ruby.
432-year pack year smoking history.
No, I'm sorry. The first dog is named Ruby. The second dog's name is unknown.
His second cousin on his dad's side had some transient left knee pain 3 years ago.
I told you she had bad handwriting.
All right, so next we have what we want to know.
Yeah, we know that, Yella. Why does she only chime in about things we already know?
I want to know when I can leave.
What was that?
I mean, the chest pain, when did it start? I'm really wondering that.
Oh, I have a hypothesis.
Yes,
So
Megan?
chest pain can be caused by a variety of causes, but I think we need to consider referred pain from a migraine. Obviously, that usually presents with pain in the great toe, but it really could be anything. And actually, we should probably consider stroke for the same reason.
What the hell is she even saying?
Yella's gonna correct her, right? Right?
Let's
point of a PBL tutor if they can't even correct blatantly incorrect info?
Actually, Megan, if you were listening in class today, you would know that.
Very good, Megan. Thank you for your contribution. What do other people think?
Well, I just officially lost faith in medical education.
I'm not really sure what just happened. I kind of spaced out for a minute. I'm sure it's nothing important. Whatever they're talking about is irrelevant usually anyway.
Let's just come up with some LOs now.
What is stroke?
What causes chest pain?
What does chest pain feel like?
When people have chest pain, does it affect the way their kids perform in school?
Wait, guys, how do we feel about half of us doing LOs this time and then the other half doing them next time?
Yeah.
Oh, that's a wonderful idea. That's great.
Well, let's calm down for a second. All of us need to learn. I think it would be best if everyone, thank you, Ritika, if everyone looked something up and broadened all of our knowledge bases. Being a doctor means being a lifelong learner.
Well, she can kiss her nice eval goodbye.
So in the spirit of being a lifelong learner, I think you should do an LO too, Ayala, don't you think?
Yeah.
I guess so. Sure. Pooja is literally the worst student I've ever had, and her eval will reflect that.
Thank God that's over. I never thought I was going to make it out of that alive.
All right, good morning. Time to start doing LOs. Thank you, Ritika, for being on it.
Yeah, you're welcome.
So I really hate LOs. I have to sit here and listen to them drone on about this irrelevant information. None of it is clinically relevant.
LOs are the freaking best. All the learning and all the collaboration.
LOs are the worst. I had to take 3 shots of vodka just to prepare for them. I think I need another one.
Hey guys, sorry I'm so late. I had to go get snack, you know?
Well, where's the snack?
Got water. Vegan, gluten-free, works for juice fasts.
No! No! You know there's 0 calories in water, right? We're gonna be starving!
Eric's on a high-protein diet.
This has been a terrible day. First of all, I come to PBL and Ritika is super excited to be here. That's totally unacceptable. And second of all, water? Really? For a snack? She didn't even bring enough water bottles for everyone in the PBL. There's 9 of us. She brought like 4 in.
So there are 7 deadly sins of LOs. Sin number 1, the never-ending LO.
So my LO was on coronary artery disease, which can be confirmed or ruled out on clinical grounds in patients with chest pain in primary care, emergency departments, and cardiology clinics with levels of discrimination up to 91% based on AUC. The clinical characteristics of chest pain, age, past medical history of cardiovascular disease, gender, abnormalities of EKG were the predictors of CAD, most commonly reported across all the studies that I looked at. And I looked at like 300 of them. The comprehensive search and critical assessment of articles conducted by 3 reviewers in 3 of the studies I looked at
Very
followed
impressive.
standard guidelines for reviews of observational research. This was the strength of this study, huge strength. It provided strong evidence of the performance of discrimination calibrations and reclassification measures of the diagnostic tools that predict CAD in different clinical settings. The diversity of the methods used across studies may have an effect on the external validity of each individual case. So there were lots of systematic reviews on the value of the clinical assessment of patients with suspected CAD, and these have focused on.
Sin number 2, the one-sentence LO.
And so here's a guy having chest pain, and that's what chest pain is.
This is what we pay hundreds of thousands of dollars for?
Sin number 3, the overly complicated LO that no one gives a shit about.
Okay, so when the ion binds to the beta subunit of the S wing of the receptor at an exact 30 degrees, this stimulates a complex intracellular cascade, starting with PLC gamma 1AB, that results in intracellular calcium concentration reaching 0.5 times 10 to the negative third moles. But if it's below that, that starts a negative feedback loop that hyper-attenuates the entire cascade in a process that I will talk about in just a few moments.
So I have no idea what he's talking about, and I feel like I should probably know more than him.
Sin number 4, an LO that's not on the right topic.
Alright, so the etymology of the word heart is actually super interesting. As you can see, it originally comes from Germanic and Old English, and we've got some Dutch, German, and Greek influences.
She was supposed to do an LO on cardiac embryology, not etymology.
Is this what they mean by biopsychosocial curriculum? Why did I volunteer for this again?
Sin number 5, reading verbatim from Up to Date.
In the evaluation of the acute stroke patient, imaging studies are necessary to exclude hemorrhage as a cause of the deficit, and they are useful to assess the degree of brain injury and to identify the vascular lesion responsible for the ischemic deficit. Some advanced CT and MRI technologies may be able to distinguish between brain tissue that is irreversibly infarcted and that which is potentially salvageable, thereby allowing a better selection of patients who are likely to benefit from therapy.
Sin number 6, reading straight off of lecture slides.
What Does Chest Pain Feel Like? By Ben Hires. Patient story. Jessica, 35 years old. I was folding laundry, and then, all of a sudden, I felt as if someone had shot me in the middle of my chest. I flew backwards by at least like 10 feet. Then I felt like a woodpecker was drilling into my left arm. But I turned and looked, and there wasn't a bird there. So I went to the hospital. I hope I won't have chest pain again, but I probably will since I'm still using cocaine.
Sin 7, doing your LO during somebody else's LO.
So there might be future studies where we get diagnostic tools or validate the ones that we already have to look at CAD, or we could use more uniform predictors about outcome analyses. Ideally, the outcome should be all clinically relevant cases of CAD, rather than specific ones such as only angina and MI.
It's like she thinks I have no idea what she's doing.
I'm so efficient, and the best part of it is Ayala has no idea what I'm doing.
And if you're unfortunate, then there's another sin. iMessage pop-ups during your LO.
Alright, so for the evaluation of chest pain, there are these things that you need to think about. There's a huge list, as you can see, and some important ones to deal with. So, anyway, so important ones.
They said it, I didn't.
To deal with: onset, provocation, where it goes, how does it feel, if it's sharp or dull, if you have pain in your arm.
Why do I always forget to turn off my iMessages?
At least it wasn't as awkward as that PBL when Eric Chang found out he got some girl pregnant.
I'm annoying. It's not my fault they can't appreciate interdisciplinary learning. Please.
So impact measures, like whether the predictive tool is used by physicians and whether it changes therapeutic decisions or
That
not.
is excellent, Rachel. I'm sorry to cut you off, but it looks like we're out of time.
But we didn't even get to today's PBL.
And whose fault is that, Ritika?
This is why only half of us should have done LOs.
I'm not sure why Ben is yelling, but on the plus side, I found this awesome video of an elephant painting an elephant.
Okay, guys, let's just leave.
All right, so learn things, look things up, read a lot, think deeply.
No one drank my water.